different fields of medicine as different types of sports. So there is no comparison between different sports. It is just knowing what that particular sport is. We don't say that football is greater or bigger or better than cricket. There is no comparison between table tennis and cricket. It is just what the sport is. It is just what is the quality or the particular way the sport is played into, and I just have to see if I fit into football or table tennis. In this context, I get a very frequent question that should I be choosing general surgery or general orthopedics? So here is what I would like to say, just to explain you what I had mentioned earlier. See, surgery is kind of the fine art of painting, and orthopedics would be something like sculpture. So there is no comparison between what is good and what is not, what is more artistic and what is not. It is just the way it is. Sculpting is the hammer and the chisel, a little more rigid, and painting would be a little more finer, a little more colorful, a little more grace. That also is in sculpting, but to inculcate that grace, you have to have a certain set of skills which are very different from what you need to be a good painter. So painting is surgery, sculpting is orthopedics. You have to decide what is your interest, or what interests you more, what skill set interests you more. This is primarily most important than the scope of sculpting, the revenue generation from sculpting, the possibilities of general surgery, the scope of general surgery, and whatnot. This, I feel, is of prime importance in the budding stage of being a medical aspirant.